Hello, and thank you so much for joining us today. I'm Avril Benoit, joining you from New York City, where I'm the Executive Director of Doctors Without Borders, Médecins Sans Frontières, or as we're known by our acronym MSF, and you might hear that acronym many times, MSF. We're an independent medical humanitarian aid organization. This roundtable is a collaborative effort between Greenpeace and two climate health groups within MSF. MSF's Canada's Humanitarian Action on Climate and Environment Initiative, and also the MSF Urban Spaces Initiative, an initiative about organizing action within local communities in solidarity with the populations that we try to help with our medical action. Over the last few months, Greenpeace has been running this series of discussions that explore intersectionality and social movements. So many of the issues that we're encountering today are interconnected, and this is certainly true when it comes to our health and the environment in which we live. With this in mind, we've brought together a range of experts and implementers, activists, to discuss how these two areas are related and to share their experiences on the work they do within communities around the world. The climate crisis, as you know, exacerbates health and humanitarian concerns in parts of the world where people lack access to healthcare and they struggle to meet the most basic needs of survival. Health is a critical issue when it comes to the protection and enjoyment of human rights. Poor health outcomes have a direct connection to the polluted and degraded environments in which so many people live. And that's why today we're amplifying the voices of those who are working across different sectors in this planetary health topic. Planetary health, that's what we have come to call it within my organization, and we hope to bring you along to understand, unpack, and see what you can do. We'll hear from activists organizing in the most vulnerable regions of the world, demanding social justice and a better quality of life for their communities, sometimes at the risk to their own well-being. I'm so honored today to be joined by our panel, Monique Kamat, President of the MSF South Asia Regional Association. Monique is joining us today from Mumbai. Marcelo Salazar, Executive Coordinator of Health in Harmony, Brazil. He's joining us from Altamira in the Amazon rainforest, and fingers crossed that his internet connection will hold up through this broadcast. Priscilla Nyaba is Executive Director of Youth Harvest Foundation in Ghana. Welcome, Priscilla. It's good to have you with us, and we hope also that you have strong Wi-Fi there. And Anushka Bhaskar is a member of the Intersectional Environmentalist Council and founder of Avrita, and she's joining us from Los Angeles in California. Welcome to all of you. I hope we now just have a couple of you on screen. Maybe we've lost the others. So why don't we start with you, Monique, to describe a little bit the work that you do and how it comes together. What is the work that you do that connects climate change, environmental degradation, and health?
So climate change, I mean, gradually as going ahead, you see that it has absolutely ingrained in our everyday lives now. And in the last 2 years, in fact, in India, we've seen that it has come so close to home. Up till now, it was a little far away, but health professionals like me who have been, in the field all the time, as a physician as well, we've seen so many sicknesses that have come back, people who have been affected, started coming without a real realization of why all this is happening. Of course, prior to COVID as well, in the last 2 or 3 years, we've seen that, there has been heavy rainfalls. In fact, last year, if you've noticed, rainfall continued until November for us, which earlier it was only up till September. And then it affected the whole crops, like, for example, the rice, the wheat, the mango, the fruit crop. And then we had these huge droughts, which led to suicide of farmers. The mental health of the whole population is is not stable, and then clinic with health problems which they are not able to identify. There's anxiety, they don't know what is the anxiety due to, they attribute it to economics, they attribute it to agricultural issues. But in complete honesty, this is a larger problem, and the awareness is so small, really. We as health professionals are also not really knowing how we can, in our everyday lives, bring people to realize, that this is a problem that is, larger than what we're able to see. This is the present scenario, actually. Yeah.
It really is so devastating to think through all of that. Anushka Bhaskar, can you give us your sense of what you're hoping to get out of this roundtable today? You just heard the direct experience from India. What are you looking for in this discussion today?
That's a great question, Avril. And first of all, I'd like to say that it is such an honor to be here, especially as somebody who is studying these topics inside the classroom. I'm currently a student at Harvard College and majoring in government, but hoping to study medicine as I graduate. So, to hear from health professionals who are doing this work in their everyday, that's a big part of what I'm hoping to bring here in the US, and also really bring young people into this movement. Provide some perspective as a young person who really cares about this intersection and who's really passionate about framing what can sometimes feel like intangible things like climate change in a very tangible way, in that frame, in that lens of health, both domestic health here in the US and also global health, because I think so many students here in the United States, so many young activists are very connected to these problems from this lens of planetary and personal health. So I'm really looking forward to hearing about that.
And there's so much, even in California itself, quite apart from the global lens that you're also focused on.
Definitely. With the wildfires and other, we've seen the effects firsthand, and it's really taken a toll on so many communities. Luckily, not my own specifically, but very, very close by to my own.
Marcelo Salazar, joining us from Altamira. Glad your connection is holding for the moment. Can you tell us what you're hoping to be able to share as a main message today in this roundtable?
Okay, it's a really great pleasure to be here with you all. And here in Brazil and the world, we are right now in a very hard time and almost crushed under the foot of a extreme right-wing government of Bolsonaro and their followers. This guy is a genocide here. Like, Brazil has now over 255,000 deaths of COVID-19, 1,000 of them among indigenous people. And beside of that, we are in the strongest of climate crisis have we ever faced it. And here in the Amazon rainforest, the fires are every year higher, and the deforestation is about 20%, meaning it is in the tipping point. I'm here, and I expect to hear from my partners in this roundtable what is going on in your areas, and how can we deal with these hard times. This is what I expect for this conversation.
I can't quite see if Priscilla, who is our other panelist, has been able to reconnect from Ghana. It looks like maybe you have, Priscilla. Can we at least hear your voice to confirm that? Not quite. Okay, so we're just going to hope that she finds a way to reconnect. We were connected earlier. Well, let's get into some of our discussion then. It's such a complex question. When I started really focusing on climate change myself, just out of a concern as I was working for MSF, or Médecins Sans Frontières, known in English as Doctors Without Borders, it was around 2006 or 7. And we couldn't quite put our finger on what exactly we were seeing in our medical operations that could connect to climate change. There were always so many other factors that all seemed very complicated, and issues of human rights abuses or governance, corruption, how agricultural lands were managed, oceans, degradation, and all these issues. We couldn't quite figure out, honestly, how to make the connection. It seems so clear now, though. There is plenty of evidence, And Monique, you were talking a little bit about, the situation with the farmers in India. At what point do you find that people really do connect? What is the issue? What is the link that people in India are making now? And is it still clear to them that there is this environmental aspect to their health outcomes?
So I think what is noticed now is, I mean, earlier, of course, there are these health issues that are very obvious, which are at the micro level, you can say at the community level, that are observed. But now what we gradually see is the movement of people. Actually, it is about migration of people. So when people start moving from their rural zones to the urban areas, and this is particularly seen in states which probably are able to absorb them, like Mumbai, metropolitan cities, like Bangalore or Chennai, that are in India. You have this rural population that slowly starts to move to the urban setup, and gradually urbanization itself is a way which the rural population is really not used to being in. It is a completely different way of life, knowing fully well that the urban setup in India already has an unemployment rate. You have so many people coming in. The infrastructure in which they live, or the houses that actually they are made to put up with, they are not optimum. The space constraint that is there, slowly and steadily, this is starting to come right on our faces. And you see that the state, in the sense the policies, are becoming more and more restrictive. As in, you will hear every other day, like today I read in the newspapers that Haryana says 70% of jobs should go to only people from Haryana. Like Mumbai or Maharashtra will say X amount of jobs will only go to people who are living from Maharashtra or living from Mumbai. So all these migrants who are now moving to an urban setup, which is completely new, there's an unemployment which is probably high, there's a young population that is moving. All this is gradually no longer just an issue of poverty, no longer just an issue of malnutrition, no longer just an issue of aches and pains. It is now coming right on our face that this is something completely different from what we've dealt with before. Yeah.
And Bhaskar, in your work and research, what are you finding in terms of that awareness and the connections that people are making between health, their health, and all these environmental issues that we face?
Sorry, was that directed at me?
Yes.
Yes. Awesome. So yes, in research, so I've been really lucky to be a part of the Domenici Lab over at Harvard School of Public Health. And so that lab has done a study very recently, which came out in the middle of the pandemic. And so I think what's very present for a lot of people where I am is obviously the COVID-19 pandemic and around the world. Right. But really, and understanding the links between the pandemic and climate change and the reciprocal interactions, that's been really tangible for a lot of people. And one of those links that was made by this lab is that in the US, in counties where there were historically higher levels of PM 2.5, which is an air pollutant, as many of us know, that was positively associated with higher mortality for COVID-19. So we're seeing that, with his air pollution and other factors associated with environmental degradation, places where environmental injustices have been occurring for a long period of time, like, for example, Cancer Alley, which is a stretch of 85 miles or so in Louisiana, where there are petrochemical plants particularly located in Black and brown communities. Those communities are facing, even worse health outcomes of COVID-19 than communities where there isn't that level of air pollution and there isn't that level of chemical exposure. So we're seeing that this interaction between the environment and health is becoming even more tangible during the pandemic. And that's something that research is really bringing to the forefront at this time. And that's something that, I'm really excited to get more young people involved in the research components of this, because I think that makes it very, very tangible. And so sort of breaking down the academic barrier to research and helping people see the data is really something that I think is helping make these issues more tangible and really help people see the connection between human health and the environment. So that's what the research is showing. Avril.
Yeah, it's something that I'm glad the research is showing this, and that there are researchers that are really working on this. We have people joining us from all over the world, and I suspect that some of them are probably doing this kind of work. By the way, I just want to mention that Priscilla is still trying to reconnect from Ghana, and unfortunately is having some technical issues there. But we will be sure to bring her into the conversation as soon as she can link up. Marcelo, let's just shift to you for a second and the human rights side of things. And you did allude to it a little bit. Your work on human rights violations, trying to do the activism in the Amazon basin, is very much linked to the health issue. Can you tell us a little bit about what your work looks like on the ground? What it is that you're really doing, seeing, and trying to focus on?
So by Health and Harmony, because Health and Harmony has a perspective of planetary health, so we are concerned about many issues here inside the Amazon rainforest, not only healthcare to the people, but we are, of course, doing like health expeditions, trying to do the connection from the government to the traditional people, doing advocacy so they have a better health assistance. During the pandemic, we implemented together with Social and Environmental Institute, local associations, more than 15 points of internet to do telemedicine, so the people don't need to come to the city for some basic issues on health. And we also offered them, the local people, the indigenous and rubber tappers, like tools and some complementary foods to they stay at their territory. And the traditional people sent goods from the roots and from the forest to families in a difficult situation in Altamira City, for example. So we work in between worlds, and we are really concerned about the relationship between deforestation, degradation, illegal mining, and the destruction of the forest and the health of traditional forests. And one thing it's really important for us, it's to do all we do in the field. It begins with radical listening of the people from the forest. They know what to do. They know what they need to stop these threats on the forest. So we are here to support them on this issue in various ways.
Well, one of the things we were hoping to do in this roundtable was to give you an opportunity as activists, as researchers, as those who are working in this area, to ask each other questions and prompt some discussion amongst yourselves. So Marcelo, maybe you could start by asking Monique the questions that you had for her.
I lost my questions here. Sorry.
That's okay.
I mean,
we can switch it around.
Okay, Monique, if you
okay, we got it.
Do you want to move for another person?
No, go for it.
No, Monique, if you can tell more about the work you do there and how this health and climate are connected in the field, and give us some examples, will be really nice.
You know, I mean, like I said earlier, it is very hard now to, now say that this is not connected anymore. Whether it is human rights, whether it is health, and it's climate change, it's all one enveloping the other. And really, where is the root of all this? It is hard, it is hard to judge whether of course, all this is also related to the responsibility of the state towards, towards trying to bring optimum health, trying to bring a livelihood, trying to bring employment. So you cannot any longer say that state cannot take the responsibility of climate crisis any longer. It will impact one over the other if we have to see progress and finally health for all, which we aspire. For example, in our everyday, in our everyday health practice, we see, one pandemic, of course. So how much ever I try to break free from the pandemic, it is looming so much around me that I'm not able to find, examples that are so far away from pandemic. But really, pandemic has unfortunately shown us that all those who had moved due to drought, due to increase in the sea level, due to increase in heat to the urban areas, could no longer afford the urban areas. They all had to do a reverse migration. Reverse migration to what? There is nothing back home. So, you saw people who went from a fairly adapted, stable environment to an environment which nobody knows how to deal with anymore. So people went back to forests that they came from, the tribals and the Adivasis. They went back to tribals. Now they don't know how to deal with the forest. People went back to farms, but there are no more farms. And what happened? When they went back, you saw kids coming back with malnutrition. You see women with hemoglobins like 4, 3, 2. So the 7, those women that we saw at a hemoglobin of 7 and 8 came back in 4 months with a hemoglobin of 4, 5, and 6. Now, how do you break free from all this? How do you break free hunger from climate? How do you break free? Other example that I can really think of before the pandemic was, suddenly I saw a surge of dengue and malaria. Like I told you, last year before the pandemic, the monsoon went on in Mumbai till November and December. Yeah. And then all these malaria cases that came in, which earlier we had seen had regressed to some extent because of a good malaria program, let's say. So none of us were really prepared for a resurging malaria or re-emerging malaria, and this is what we saw. If you see, the slums, the rise in sea level, suddenly people were adapting to water coming into at high tide and then going back again. Now you see the water coming into their homes more often, leading to all kinds of fungal infection, Madura foot, due to wet feet. Now, how can you say this is not because of the rise in sea levels and the water coming in regularly? They have all these bories, or I don't know what, sacks of plastic that they build their houses on. I mean, how do we prepare a community that has moved from a rural area, spacious rural area, to slum in Mumbai, Ambedkar Nagar, Kolaba, where you constantly see sea coming in, sea going out, sea coming in, sea going out. And these incidents earlier, but few people were adapting. Now it's so much more that is happening. And the cost of that infrastructure, of rebuilding it, adapting, the mental health crisis, I mean, this is what we see every day. Yeah. And this is only a small bit I'm talking about. I mean, air pollution, COVID and COPD. What is happening in Delhi today? Suddenly the temperatures have gone so high. It was so cold. The number of deaths that have occurred during the change in weather and the temperatures that have gone so high. Today in Mumbai, it's March. It is 36 degrees. I mean, we've never seen these temperatures really. So it's becoming an everyday issue of our lives.
Great. Can I do for you like a more personal question? Like how has your experience living and working in India influenced the work that you do?
So I think so the pressure of being in India is because it is coming so close, scalability. So earlier we used to have pilot projects. Earlier we used to have small projects that we could say that, okay, this is happening. Today, if you are a frontline person, maybe working with an NGO, maybe working in a leadership role, the pressure of scalability is really very high. You have to for me, in a leadership position where I am, I work with tobacco cessation and its impact on, on the population. So I work very closely with healthcare workers, with other healthcare workers in hospitals and workplaces, where I work closely for tobacco cessation. Suddenly, that COPD that was there earlier, which we were gradually dealing with and treating and counseling patients for towards tobacco cessation, smoking and non-smoking kinds of tobacco usage. Suddenly, that COPD, which I had the time to deal with, I don't have the time anymore. I have to reach to a more number of people given the same infrastructure. And I think this is the biggest challenge that I face today in the position that I sit. Yeah.
Amazing. Thank you a lot.
Yeah.
I have great news, and that is that Priscilla has rejoined us, or at least she had rejoined us for a moment. And now I don't see her anymore. I was really hoping, oh no, okay. No, I think that's not quite going to pan out. But we forge ahead. You're watching a special live stream. It's a roundtable talking about the interconnection of health and environmental concerns, including climate change. And my guests are Monique Kamat, the president of the Médecins Sans Frontières, or Doctors Without Borders South Asia Regional Association. We have Marcelo Salazar, executive coordinator for Health in Harmony in Brazil, and also Anushka Bhaskar, member of the Intersectional Environmentalist Council and founder of Arvrita, joining us from LA, Los Angeles. All right, well, let's continue our little roundtable. You asking one another questions. Perhaps you could go next, Bhaskar, with your questions for Marcelo.
Definitely. Marcelo, I'm so excited to get to ask you something that I've been wondering. So I guess I'm very inspired with the work that you do with Indigenous communities. That's something that I've also been really interested in doing here in the United States. But for you, what challenges have you faced over the years when working with Indigenous communities and trying to protect their rights?
Micro. So thank you very much for your question. Like in the 20 years I work with the indigenous and traditional communities here, I had every sort of challenge, and I could tell you lots of histories about fights against Belo Monte Dam, for example, that involved immense organized parades and demonstrations. For example, one of them, the indigenous cut an engineer of Belo Monte Dam, the company that would construct Belo Monte Dam. So lots of conflicts on the field. I could tell you about expeditions with indigenous leaders, scientists, and people like James Cameron and Arnold Schwarzenegger inside the community village to discuss new ways of development in the Amazon rainforest. I could tell you histories about rescues of people inside the jungle. I can remember now, like a boy in the Madeira River that was bitten for alligator, a big alligator, and we didn't know what to do. We had no resources in that place to save that boy, and suddenly a helicopter came to do the maintenance at the energy place. Like, it was incredible, not a coincidence, but things that we live in the field, and the boy is alive until today. But I think the biggest challenge we face here, it's in day by day. Like, it's the challenge to do the work one day after another, like to build trust with the communities, to stay here 10 years, 20 years. And I feel the same pressure Monique said. Like, we did pilots some years ago, but now we need to scale. We need to be faster than we did before, but we need to follow the rhythm of the communities at the same time. So this is, I think, the challenge is to keep here, to get high-skilled people to the Amazon rainforest, connected to the people outside, and supporting the indigenous and traditional communities to face those challenges. So I think it's something like this.
Thank you so much. That's a true testament to your work, and also the intricacies that I think not many people would know if they haven't done that work firsthand. So I really appreciate that perspective.
Thank you very much.
Yeah, and
Keep going. I know you have more questions.
one more question I have is that how have the decisions, so this is something that I heard Monique bring up a little bit earlier, but really it's that involvement of like the state and the responsibility of the state. So I know you mentioned that, Brazil is facing some very interesting political situation at the moment. So how, in your experience, do the decisions of the Brazilian government affect the work that Health in Harmony does, considering the situation that we're in?
Yeah, no, we are here nowadays, as I said before, under the Bolsonaro government, and things are really difficult. Not only because this guy doesn't respect human rights, but he don't care about the forest. He don't care about the climate change. People in his government says that the earth is not rounded, the earth is flat. So they are crazy, and we are dealing with it. And what is really bad, it's this government is giving incentives for the people to invade the forest, to do land grabbing, illegal mining, illegal logging. And in the middle of that, the traditional people are under a big threat. And besides that, there is the climate change into the territory, so more fires cause less rain, or disorganize the rain seasons and the river flow seasons. So it's very difficult to deal with that. And we are pushing hard to face this challenge. And more than ever, we need the partnerships from civil society, from the international community, to press this government to do campaigns, to not buy products from, for example, rainforest deforestation. Don't buy meat from rainforest deforestation. Don't buy goods from these places. Don't buy gold if you know the gold is coming from an indigenous territory. Ask where the goods you're buying came from. And support wherever you can the fights. It's not the situation it's not only here in the Xingu River, but all the Amazon rainforest and now the country, we are dealing with this kind of pressure. So it's tough, but it gives us the opportunity as well to create new connections, to create new solutions, and move forward.
That's beautiful. And you have my full support. I would love to do as much as I can to support your work. And on a personal level, that tangible piece of information you gave, or take action by, voting with your dollar, if you have that privilege, I think that's a very powerful thing, especially to support from an international perspective. So definitely, thank you so much for that. All right.
Okay. To add in the final stuff, we need to do what is necessary, not only we are prepared to do. For example, we work with the traditional communities inside the jungle, but because of the COVID situations, we are in the limit of the hospitals here in the city. So we join it to other organizations, and we create a campaign called Breathe Xingu, Respira Xingu, to support the local government to better equip the hospitals, to do awareness in the urban areas as well, while we deal with the forest. So we need to move fast and many times do what we are not fully prepared to do.
All right, it's your turn, Anushka, to be on the hot seat. Monique Kamat has some questions for you. Go ahead, Monique.
So Anushka, it's nice to see a young person like you who is so involved in climate crisis, like we say. Really, from where you sit, how far do you see the impact? Especially, yeah.
Yeah. So, I think for young people, I think it's something that, at least here in the US, I've seen so many young people really taking up the mantle, particularly those who are living in communities that are on the front lines of this crisis. I think I'm really inspired by people that I've met, like Mari Kopany, who's also known as Little Miss Flint. So she's from Flint, Michigan, which was a community in the United States where clean water was very limited because of a lot of different policy failings, but also from a personal, on a corporate level, there were some problems there that led to contaminated water. And so the communities in Flint were facing, drinking basically water that had been contaminated with lead. And so we saw young people in Flint and across the country and other places where there have been environmental injustice, the Dakota Access Pipeline. We saw that in so many other places where environmental injustices were occurring, where young people were taking up the mantle and speaking out and telling governments that, you know what, this is not going to stand. I'm not going to sit by while my elders, my ancestors, those around me are facing, the health effects of this crisis. And I think that young people, don't have to wait to be convinced by, witnessing in person the health effects. But I think more and more of us are starting to see those connections even in our own health. So for some background, actually, on my own experiences, I actually grew up both in India and the United States. So I can really appreciate where you're sitting, Monique, and have so much empathy for the community in India, because I feel that that's my own community as well. And I grew up with my grandfather, who was a professor at the Indian Institute of Technology, and he was a civil engineer. And in my youth, I got to witness him working on projects in the Ganges River, where he, would see that, you were talking a little bit earlier about the flooding and the health effects of, basically like the water management systems and the Ganges, and how like pollution plays a role in that as well. But basically I got to witness him crafting his own solution to that problem. And so for me, witnessing my grandfather in India doing that work, I was inspired to see, what can I do when I recognize the health impacts of the environment in my community to get other people involved? And also, how can I get other students, other young people to see this connection of health and climate change? Because I think a lot of people understand climate change, but sometimes are looking for that more tangible and personal link. And so this story actually is really interesting, because actually my grandfather fell really sick, the healthiest person I know. Like, this guy used to eat khichdi, which is like a traditional dish in India, where it's like lentils and rice, like super plain food, really healthy. Like, he used to eat that all the time, but he still fell sick with colon cancer. And for me, I was like, wow, like how, there weren't really any genetic determinants that we know of to this day. And I'm still wondering, what it exactly was. But in large part, I think his hypothesis was that the environment that he was living in at the time wasn't the most clean or, taken care of. And so I think that for me, witnessing him suffer from colon cancer was a real wake-up call to the connection between human health and the environment, and seeing that, like the people even in my family have been affected by the environment changing and then being exposed to toxins. And so that was something that was really motivating for me. And I think as a lot of young people, unfortunately, start to feel the health effects themselves, they're galvanizing others. There's an activist friend of mine, Kevin Patel, who himself at such a young age, at like 14, 15, started to suffer heart problems from living in LA in a polluted community where there was a power plant nearby. And so I don't want to speak for him, but I remember him saying to me that, that health impact was a huge driver towards the activism he does today with One Up Action. So I really appreciate the question. And there's so much of my personal story that connects to that. But also I think so many personal stories of so many young people around the globe and in the United States in specific.
Understand really, because it is no longer somebody else. That's why, in fact, it's now one of us. It's us, either as professionals, as people, as humans. I mean, it's no longer it's not somebody else anymore, really.
No. Yeah.
Just another question that I had is, what is it that actually brought you? I mean, there are varied subjects really that one goes to study and learn, and but what brought you to this platform really? And I'm very curious.
Yeah, thank you so much for that question. So really, the personal stories that I shared with you was one component of it. But when I got to college, I really had this moment where I was like, you have that opportunity to really question, like, what am I going to study? Like, what role do I want to play in the world? And so for a long time, because I witnessed my grandfather's sickness, I knew that I wanted to. Actually, my other grandfather also suffered from like asthma and a lot of like air pollution related sicknesses. So witnessing my grandparents growing up, I knew I wanted to do something in medicine and really change the way that healthcare was delivered, because I saw them also struggle with healthcare accessibility. But since the age of 10, I had been working in the area of plastic pollution. And plastic pollution was my first introduction to the way that human health is interacting with the environment. So as many of us know, plastic pollution in our oceans is a huge problem. And for me, I was never somebody that came to the environmental space from necessarily a love for nature. I do so appreciate nature, but I didn't necessarily grow up with that direct connection. So what really brought me to the environmental space was kind of the illogicity of us as a human race degrading the environment in a way that so directly impacted our health. And so health was that first lens that led me to fall in love with environmental justice and fighting for justice in the environmental movement. And making those connections personally, as well as kind of from this like perspective of health and the environment, allowed me to continue to really question, what is it that I want to do? And so I first used to think of my environmental activism and my studies separate. I used to think that I need to study medicine and do medical school separately and study my love of healthcare separately. And I need to fight for environmental activism, fight for plastic pollution, fight against environmental injustice separately. And it was actually after learning about this concept of intersectionality that I've heard you all talk about today. Intersectionality being where you look at multiple lenses and see how they intersect, whether that's like your race and your gender and your sexuality or other factors. Really, you don't have to keep these ideas separate, and you can actually bring them together. So like what we're talking about today, the intersection of climate and health. And so that realization of intersectionality empowered me to say, what are these intersections between what I care about? I think so much of the answer was inside me the whole time, that they were so intricately connected. And I knew I'd come to the environmental movement from my love for health, but really being able to bring them together was so liberating for me. And I've seen that other young people are actually have had the same realization, have had the same two passions of wanting to address healthcare and wanting to address human health, and also wanting to address these huge, unignorable problems of environmental degradation and injustice. And I think that's been the most rewarding thing for me, is having intersectionality as a lens, and then founding Avrta based on that fact that other young people, other pre-medical students, other people that care about health in any capacity want to have the tools to address these problems inside the clinic, outside the clinic, in their advocacy work, and really have conversations with people from this perspective of health and climate. So hopefully that answers your question. And I think it's something I'm very passionate about and could go on forever about. So I'll stop it there, but happy to take any follow-ups. Thank you so much.
Yeah. Sure.
I'm curious what kind of medicine you want to get into, Anushka. What are your thoughts on that?
That's a great question. Thank you for asking. So when I was really young, this is, first of all, a dream come true, because Doctors Without Borders, I think in my yearbook at the school I attended when I was little, I wrote, or actually in in third grade, we had an assignment where we wrote like our autobiography. We wrote a book on the rainforest, Marcelo, and my assigned animal in third grade, we got to choose an animal, learn all about it, research it. And so as young as 9, I was already exposed to like my love for, global environments like the rainforest. And my animal was the marmoset. And it's like the cutest, smallest little monkey ever. It's a monkey. Yes, for sure. So, and I got to write a book about it. And then we got to make our own book jacket and write an autobiography. And so in the autobiography, I wrote, Anushka Bhaskar is a 28-year-old, I think at the time I had neurosurgeon who graduated from Harvard College and is working with Doctors Without Borders. So some of that is true today. And so I don't know about the neurosurgery part, but I have so many, whatever I do, I know I want to be a doctor who is just like yourself, Monique, and so many others, working on the front lines and helping people in the clinic, but also really working with people and government to make the connections between climate change and health clear. I want to be able to explain to somebody who comes in with asthma that it's not necessarily like only their genetics or something that they were born with, but also something that could be exacerbated by their zip code. Because I think what I've learned is that zip code and in the US, which is like a good a measure for location. So That is a huge predictor of your health, maybe more than even like your genetics and other things. So it's been, for me, whatever medicine that I decide on doing, it's going to be one that it has this intersection involved in it. And hopefully also I'll be able to work on health policy, because I think one conversation that needs to be had more is that in the system of healthcare and people who work on healthcare in the US, I want to see more of those people who are working on health policy, working on healthcare reform, also talking about how this healthcare reform is coming not a minute too soon because of the crises that we're facing. So hopefully that makes sense.
Well, best of luck with that. Get a few years of professional relevant experience and then apply on our website, doctorswithoutborders.org. Okay, a little recruitment session going on.
You can apply for Health and Harmony
That's
as well.
right. Yeah, equally
or
good.
create another innovative organization and be in the front line.
Absolutely. Hey, Marcelo, let's perhaps just because we do have a bit more time, and let's focus on one specific thing that is going on, and very much so where you're working. You alluded to it a bit before, and that's the pandemic. The COVID-19 pandemic has changed the way we see the world, right? The zoonotic disease aspect of it, the knowledge that this is a pandemic and there will be more. We have to wrap our heads around the fact that there will be more situations like this, and that hopefully we've learned something from this one. Can you tell us a little bit about what lessons you think we should learn and have learned in terms of the structural and systemic issues that made this pandemic so much worse in Brazil? And I'll ask the same question for the other panelists as well.
Great, thank you very much for this question. So I think Health and Harmony is working like in a 15 years old approach of planetary health. I think the first thing it's work in intersections, work in multidisciplinary people addressing complex problems. And the understanding of Health and Harmony is that we never lived in a world where the health of humans, ecosystems, and our planet could be addressed in silos. For many years, we've been telling people that their health and well-being are affected by the health and well-being of people living in the rainforest communities, half a world away. But it has only been with the pandemic that the most people are finally getting it. Like, we are really interconnected. So, and we are getting it. And listening Anushka and his energy of a young people, I remind myself, amazing meeting we organized here in November 2019 in the Xingu River. When we put together the people from Friday for Future, Extinction Rebellion, bigger indigenous leaders like Raoni Menkutiri, Davi Yanomami, Juma, Shipaya, and others, and scientists and so on. So we did an expedition of 7 days into the forest to discuss what to do right now. And after we came back to the city and we did a big meeting, and Raoni said one beautiful thing in the meeting, and we have no pandemic in that time. And I will get what he said. Raoni is a shaman, is the guy in the middle. If you
We seem to have lost your sound. I think you're showing the map, though, right?
Yeah.
Oh, there are the photos. Yeah, we see them.
The photos, yes. And Raoni said, I'm very concerned about the huge loss and warming of the earth. With the fact that the land we live is becoming hotter every day. The warming of the earth related to destruction of the forest, which makes the winds hot as well. Hot winds generate and spread new disease, dangerous disease. Hot winds are bad winds that carry horrible disease. Defends the land from being hot, secures the existence of winds, the cool winds that carry good water and makes them circulate everywhere. So it was in 2019, and the coronavirus pandemic did not appear yet, and the Amazon was in one of the worst scenarios of degradation. So what Raoni said, just to show an image that illustrate of what Raoni said, it's flying rivers that goes from the forest, like the trees pump water to the sky, it creates rain and regulates the climate. So the laws of forest, it's not only generate carbon, but these regulate this kind of pumping, like the heart. The Amazon rainforest, it's not the lung of the planet, but it's also the heart or the air conditioner. So I think it's so powerful. So we need to connect the young people and the forest leaders, the people from the city and the forest, and to reconnect. I think this is the key for the next steps we need to go on. And I'm very happy to listen people like Anushka, who wants to be in, who wants to be in the Amazon rainforest and or other places. Oh, I will stop sharing. It's really nice to listen Monique saying, like, we need to scale up solutions. We need to do it now. Like what I learned from the people from Friday for Futures, like that our house is on fire and we have just a little time to change it. And I said, wow, like I completely changed my plans for the next 10 years. Like I'm working that we have 10 years to change everything. It gives us a completely different perspective and need to be speed and to do lots of things at the same time without losing the connection with the people, the process day by day, and the interconnection.
And perhaps we could shift over to you, Anushka, in terms of the things that we have learned from this pandemic that we should definitely carry forward, the issues that have arisen for you that strike you the most.
Definitely. I think Marcella just started to address it. Like, the pandemic has made it very, very clear for so many people that this connection is so tangible, so real. And I think it's also made something very real that, health is something that's really interesting to me. Because I think one thing about health that I've seen is that people who are healthy sometimes tend to forget what it's like to be sick. I think that's a good thing. It's if we were always remembering what it was like to be sick, it wouldn't be a great situation either. But that makes it sometimes hard for us to maybe not only empathize, but just kind of see what it's like when people are limited in their health. But COVID-19 has shown us that, when other people are sick, we also are sick in some ways, and our society becomes sick in some ways. So climate change, I think, is making that even more clear. And so going forward, I hope that, young people, one thing that we're working on at Avartha is the creation of a curriculum to, with partners like Partners in Health, and hopefully some others here today, to educate future and current health professionals, and also people interested in health, about the connections between healthcare, climate change, and human health. Because I think that people will start to understand from the way they want to vote, the way they want to act, how this interconnection, they can influence it with their daily behaviors. So I think going forward, that's what I'm taking from COVID-19, is that I think we're actually going to have more allies in this movement. We're going to have more young people, more people of all ages, more intersections kind of connected with our intersection that we're discussing here today.
Let's hope so. Let's hope so. And best of luck to you in that effort to provide the resources so people can learn about it. Finally, to you, Monique, COVID-19, the pandemic, what lessons do we really need to learn from this?
I think COVID-19 pandemic has, taught us that we alone cannot function. It has to be collaborative. It has to be together. It has to be with other actors and players. Whether you are a healthcare worker, whether you're working alone, you're a private practitioner, whether you're an organization, you're a very big organization, it has taught all of us, you can't be free from the others, because you alone cannot do anything about anything. It has to be extremely collaborative with partners, and you cannot also free yourself from acknowledging the diversity that exists and the play that that diversity has on the impact of climate crisis, health, and the intersectionality that exists. I think that was a very big learning for me. Yeah.
Let's hope that we pull it together. I just want to pass along apologies from Priscilla Niaba, Executive Director of Youth Harvest Foundation in Ghana, who has been trying this whole hour to join us. And this is one of the inequities in terms of bringing and amplifying voices from places where the internet is not strong. It's a real challenge and a real shame. And we wish you had been with us, Priscilla, and we hope that in the chat people are finding their way to the organization that you're working with. Mm-hmm. So thanks to all of you for joining us. This is a last round robin, that is to say, we'll go with the three of you for final words of what people can do. Because we have a lot of activists tuning in from all over the world here. What would you like them to do now? Maybe start with you, Anushka.
Yeah, I think I'd really like people to first begin by looking in their own community. I think I realized that, the stories that are around us are sometimes the stories that speak to us the loudest. And so I think you'll start to see that it's kind of unignorable at this point, the connection between human health and climate change. And I hope that those stories that you find or those stories that you've heard today will influence you to vote, if that's possible for you, for people who believe in what we've talked about today, people who believe in fighting against environmental injustice and fighting for health equity, fighting for policies that address these problems, and also support businesses and like Marcelo had brought up, the importance of voting with your dollar. Support businesses, support people who are doing this work in very tangible ways if you can. I also hope that you continue to learn from all of these organizations, including Avartha, but also Priscilla's organization, Marcelo's organization, Doctors Without Borders, so many incredible resources that are coming to the front, as well as frontline activists. So that's my message.
Great. Monique?
Yes. I think for me, what I want to really emphasize on, that do not ignore the local strength, because climate crisis cannot be resolved from a top-down approach. It has to be solutions that are very local made. And just one example that I can think of is, at one point I worked with air pollution and the chula that is there at the village level, and trying to bring awareness about chula, which is a gas that works with with biofuel, and really it didn't pick up. People were not very happy. There were no takers, because they did not. The culture of that region is so imbibed in a particular fashion to deal with crisis, to deal with climate, because if you come up with new solutions that do not involve the community, that do not involve the local, existing infrastructure, I think getting success is going to be really hard. Secondly, training. I mean, all of us who work in climate change or climate crisis, either through the health, through the gender lens, through the health lens, or through the climate lens, we have to acknowledge the fact that youth cannot be ignored. So that group that sits in your, let's say, 12 to 35 age group, these are the ones that are actually going to accept, adapt, and bring change. And they are the ones who will actually need a lot of support in terms of any kind of change that we desire as professionals. One is, gently, we have to bring that knowledge that we probably have understood, maybe slightly better, I can say, slightly better than them, bring it home to them to accept the change, because this is actually, you are asking people to do something that is going out of their homes and making them do something that is absolutely, they cannot adapt. I mean, ask me to eat, let's say, another millet. I cannot, I am a rice eater. But then tomorrow I have to train people, no more, don't.
I think I might not be the only one who has lost you, but we hear you loud and clear.
Thank you.
Monique, thanks very much for that. We are at time, so Marcelo, we're going to give you the last word very quickly. If you could give some perspective on what would you like people to do now? I think you're on mute.
In the beginning of the pandemic last year, people were saying, oh, we need to escape quick the pandemic and go back to normal. And I joined a group of people in a movement called Free the Future. And I said, oh, we cannot back to normal. We must imagine the future. We must, of the time likely to bound to the present or to the past. We need innovative solutions with good and powerful dreams, awake or not. We need to be radical dreamers. We must be radical listeners, especially listen, the indigenous people. They are the first ones that they realize even the tiniest variation in the climate. They are not only the guardians of the forest, but they know how to live in harmony with the forest, in harmony with themselves. Of course, they have problems, fights, and so on, but they are in the same places for thousands of years. So we must listen to them and dream. Listen to them, dream for another kind of future.
Couldn't agree more. Well, thank you so much, all of you, for joining us today for this special panel. Monique Kamat, President of the Doctors Without Borders South Asia Regional Association, Marcelo Salazar, Executive Coordinator of Health in Harmony in Brazil, Anushka Bhaskar, member of the Intersectional Environmentalist Council and founder of Avrita. I'm Avril Benoit from Doctors Without Borders, Médecins Sans Frontières. Thanks for joining us. And if you'd like to learn more about the relationship between climate crisis and health, please follow Greenpeace and MSF, or Doctors Without Borders, and the organizations and people you've heard from today. Also, Priscilla Niaba's organization, Youth Harvest Foundation in Ghana. We very much appreciate all the efforts you make to learn about this topic and find ways to get involved in your local community, because no action is too small. Thanks so much, and I wish you